beautiful week. It's early morning here where I am, and it's raining and cold. And in this series, I want to just discuss care plans. And I know for the nurses, this is like either the biggest fear for most students, or people just have a perception that this particular thing is difficult. So I'm trying to dedicate this to simplify it and to help people just embrace it and know that they can do better in it. So if you're one of the people who really fear doing a nursing care plan, I hope this series will demystify that fear and get you going and just kick off and get to be good at it. So let's delve in and first define what a nursing plan is. Care plan is basically it's a document most of the time that we will write at the end of the day. But a nursing care plan, by definition, is a process that identifies the existing needs and recognizes a patient potential needs, or rather potential risks that they will need help and care for you to ensure there is quality in that particular area. So there are certain areas someone needs to focus when you're looking at a nursing care plan. Number one, there is the need to focus that this is a formal process. It's not something that is haphazard, like it's organized in such a manner that it has a flow. And the reason why you generate the nursing care plan is because you want to identify existing needs for your patient, and you want to recognize that patient has potential needs or risks that will need us to maintain quality and consistency in the patient care. So it's basically a tool that is used to maintain quality and consistency as nurses take care of patients. However, it is this document that is actually a way of communication between nurses, patients, and even other healthcare providers. So what are the objectives of generating a nursing care plan? Why is it being done? Number one, like we've said, this is a very formal document, and the main agenda for it, number one, is to identify your patient needs and wants. Remember, needs are things that the patient can't do without, while wants, on the other hand, are things that your patient can do without, but at that particular moment, you need to meet them. And number two, your nursing care plan will promote evidence-based nursing care. In a nursing care plan, you're able to show the evidence of why you are doing the particular issue. So for instance, if you pick a patient is having fluid deficit, you need to give an evidence what shows your patient could be undergoing fluid deficit. So we'll come to that later on though, but also a nursing care plan is supposed to support holistic care in management and prevention of other diseases or prevention of complications. So it's a very key tool that both of us needs to know. And as a result, nursing care plan also promotes teamwork and continuity of care. It helps in identifying and distinguishing goals and expected outcomes. So in this case, a goal and an outcome are two related aspects in the sense that a goal is what you are anticipating to achieve at the end of the day. Well, an outcome is what you expect to come out of it. So if maybe your patient has difficulty in breathing, your expected outcome is that the breathing rate will resume to normal. Well, the goal is for you to maintain a normal breathing rate in that case. And again, we mentioned that the nursing care plan is also important in communication among nurses, the patients itself, and other healthcare providers. So this is a communication tool, and you're able to maintain that by putting it into consideration that you even pick all this information in this document from other departments and healthcare providers. So the nursing care plan is also a document that is used to plan for the care of our patient. And lastly, it's a measure of nursing care. If you're good with your nursing care plans, then trust you me, your department will literally like trust you with everything that you need to be doing in that area. So it's something that's taken very serious, even in most of the nursing councils, I think in different countries. And like in Kenya here, it's a document that you can like nowadays I'm hearing for those who go for interviews, they're also asked to write a nursing care plan. So you have to really try to master your skill around it. So purpose, so I want you to note Objectives and purpose, they're kind of related, but objectives simply refers to why you're doing it. So that is two. So mostly you have find an objective is either to measure the state of nursing care, to communicate and so on. But for the purposes, we look at what are the advantages that this nursing care plan does. So number one purpose is the nursing care plan will define the independence role of a nurse. I know most people, especially those who are not exposed to nursing departments, they usually feel like you depend on another person to tell you what to do. But actually, there's a lot of independence because nurses operate on their nursing plans. And these nursing plans are purely not written by nurses, they're not written by other departments. So they are able to have that independent role in providing the patient care without relying on the physician's instruction. Because the physician instructions, as much as they are make part of the nursing plan, they are not the sole role of that nurse. The second part is that the nursing care plan provides a direction for individualized care of your patient. Remember, apart from being holistic and general in providing care to patients, there is need to have an individualized care, and this individualization of care can work when a nursing care plan is done because you're supposed to write a nursing care plan for each and every patient in the ward based on the disease and diagnosis that they have at that particular time. Then the other advantage or purpose for the nursing care plan is that it leads to continuity of care among nurses, especially when you're in different shifts and departments. So if you want to hand over a patient, let's say, to another nurse who is coming in a different shift, the nursing care plan will guide that in terms of communication and continuation of what is supposed to be done for the patient. And secondly, you can also use a nursing care plan to either transfer patient to another department so that they can have easy continuity in providing the care for this patient. And then fourthly, we can use the nursing care plan to coordinate care for the patient, hence preventing gaps. Remember, this care plan operates on a basis of 24-hour frequency. So every 24 hours, there's a new plan being generated for this patient. So as a result, there's prevention of any missing gaps. So that if a patient was doing in a certain way yesterday, then today you can generate a new assessment from your patient and come up with a new nursing care plan in that case. So it also promotes documentation and recording. And in nursing, we have one rule. If there's no documentation, then there's no care. So the nursing care plan indicates what the nurse did, at what time, and what were the outcome after evaluating the patient. So it's also a guide for the nursing model of care. So a guide in the sense of there are different models of administering nursing care, whether if you're using teamwork or you're using the primary nursing model. So all these models become coordinated when there's a nursing care plan, because in the nursing care plan, you may not write all the team members there, but it will show that this particular team coordinated themselves and achieved this particular nursing care plan at that particular time. So the tool also will help in monitoring progress. And lastly, it will define for you your client goals. So a nursing care plan is a very, very important document that each and every student and nurse out there has to master and understand how to handle it. So that's the reason why I started this series, and I'm starting to enjoy it because I'm realizing I'm touching on an area that most people, given a chance, they'll be like, I'm not going to write this nursing care plan. So if you really like this series and you want to get more out of it, kindly click on the subscribe button, get to click also on the notification button so that we can flow together. So I will run on this series for the next coming weeks. And then I hope by the end of that, you will be good at your work and you'll be able to generate a very nice nursing care plan, both as a student and also as a nursing practitioner out there. Thank you and bye-bye.